When we were thinking about who should attend the walk-arounds, we felt it was very important that the representation signalled board commitment, that it was very clear that this was being led by the board, and from a personal perspective, with the importance that I'm placing on the Thousand Lives campaign, I felt it was important that I was involved in that at the outset. For two reasons. One is that it is about an important campaign and we have to get that message out to practices, and it needs to be seen to be led from the board. Secondly, from a practice perspective, we felt it was very important that the people who went to do the walk round weren't people who were normally associated with other activities with the practice, for example, their contract monitoring visits or clinical governance. We wanted this to be different and we wanted it to be separate so that we can have a free-flowing discussion and be seen as a separate initiative. So those were the things that we considered. In terms of which practices we picked, we went for a balance of those who we knew would be fairly blunt and open with us in feedback, and also those who we knew were quite well organised in terms of the way they worked as a multidisciplinary team, that they had regular meetings, so they were comfortable in talking about safety issues together as a team. So we had two different practices, different characteristics, both of benefit to us, and those were the ones we picked for our first visits. When we were thinking about the practice visits, we took into consideration a couple of issues. The first was the need to prepare, and for both us and the practice to be aware of the purpose of the visit, how it might be handled, what the context was for that visit, the sort of discussion that we were hoping to have. So we prepared some background materials using some of the reference documents that are available on the campaign website, adapting those for Wrexham Local Health Board to give it a local feel, and we gave that material to the practices. In terms of preparing ourselves, we had discussions between myself and the non-officer member who came with me to do the walk around, to make sure we were clear about our roles, expectations, and that we were confident that we could go out and have a conversation knowing that we would learn something in the first couple of visits, that it wouldn't be perfect, and that we were comfortable in explaining that to practices and asking them to help us develop. The final issue, which was important, was getting the timing and the duration of the meeting right for the practice. And what we tried to do was to fit in with natural meetings that practices have. So, for example, one of the practices regularly had a slot where the doctors would sit down at the end of the week and discuss case issues, and it was part of their normal practice working to come together. We weren't really surprised by the findings. Many of the issues were ones which we were aware of. There were a range of issues around medicines management and patient safety which weren't a surprise to us. There were issues in relation to communication, particularly with hospital services, which wasn't really a surprise. But we were pleasantly surprised about the openness, pleasantly surprised that the practices were prepared to talk about experiences they'd had. They were prepared to share the details of those with us, what they'd learned from them, where things had gone well, where they hadn't gone well. And also we were pleasantly surprised by some of the good practice we picked up. Things we wouldn't stumble across in other ways, that we were able to ask practices to share with us so that we could share the learning across other organisations in Wrexham. We received some feedback immediately from practices almost as the meetings were closing, and it was very encouraging. One of the senior partners in the first practice we went to commented it was refreshing to have a conversation about the real issues, not bogged down with bureaucracy and contracts, but just to sit down and talk about what it's like in practice and what the issues that they face day to day are. So that was quite encouraging. And then subsequent to that, we have, as an LHB, we have a number of staff who regularly work into practices, so our pharmacist team, our nursing team, and they've picked up feedback from other people who were present at the meeting, saying they felt it was useful, it was a good opportunity to talk about general issues, and that's been quite positive. We're taking the information that we gained from the practices and making sure that's fed back through our Thousand Lives steering group within the local health board. We're developing an actions log of the issues that arose in the meetings that we had with practices, We tried at the end of each meeting to capture some key actions, some for the practice, some for ourselves, and we're pulling those together now, and we'll be monitoring those as part of our active development of the 1,000 Lives campaign. We will also include the feedback and the improvements and the lessons learned when we do our regular board reports. So it will come to the attention of the board, and we will also then try and use that information in our communication strategy as well to share across practices, particularly to share the good practice and the learning that we've taken from one that may be able to benefit others. In terms of the use of our time, we found the walk around to be a very positive use of time, very beneficial, and something that certainly I would commend to others to do. It's often difficult to set these things up and to secure the commitment to do them, but having experienced such a positive reception and such an open and frank discussion, I do feel it's a very important element of the campaign, and one which will bring lots of benefits to us. From our first two walk-arounds, there were a couple of lessons that we learned. Firstly, that in preparing for them, it was very important to ensure that the people we were going to meet had actually had the material, understood the material, and were able to put the meeting in context. I think our experience the first time round was that wasn't the case. It added to the interest of the meeting, but we did learn that we needed to do that. The other thing which we also learned was that we needed to put aside time at the end of the visit to record the issues, to be clear about the actions, and to communicate that very quickly. It took us a little while to do that, and that was something that we learned, that as part of the visit process, closing off the documentation, the actions agreed, and issuing that very quickly back to the practice is something that we need to get better at the next time we do it, and we're actually putting in place strategies to do that. I think it was a very good use of time for myself and for the non-officer member who came with us. We had a very open and frank discussion. We talked about real issues that affect practitioners and the patients they serve, and we identified some very practical things that we could do to help them and that they could do in terms of improving their own services, but also sharing their experience and learning with others to improve patient care across Wrexham. Our current plan is that we will try and extend the programme of walk-rounds. We want to do some more with general practices to continue our process of learning. It's still very early days. We do feel the first two were very positive, but there's things that we want to tweak to try and get the process a little bit better. So we'll definitely do that. Our aim then is also to try and pilot walk-rounds, particularly in a community pharmacy setting. There's a lot of medicines issues emerged in the meetings with general practices, and we'd also like to get into dentistry as well and pick up some of the safety issues there. So consolidate our work in general practice and then begin to looking at other settings. I'd advise others who are thinking about using walk-arounds to definitely give it a go, to think carefully about the preparation. We learned lessons on that, and I'm sure others will as well. To think carefully about which practices to go into. We made sure that we had practices who we knew would be honest with us, we knew would be blunt, but also were mature enough to understand what the context of the visit would be and were able to engage productively with it. So I think there's an issue about early selection, and be prepared to learn as you go. It won't go perfectly, but I think you can draw value from these conversations, however well they go. And we hope that over time our success in terms of identifying issues and moving on will certainly grow from using walk-arounds as a method of engagement. The practices had an interesting response to our visit. Some of it was around a cautious response, particularly with my presence as the Chief Executive and as a board member going along. But people were very willing and eager to meet and very prepared to be open, which was refreshing and gratifying in the process. So there wasn't really a sense of suspicion there. There was a sense of caution, and I think that hopefully will have been allayed by the discussion, the feedback, and importantly the action planning that follows. I think if we're able to make the meetings productive and actually lead to action, that practices can see tangible improvement, then any suspicion or caution will be outweighed by the benefits.